Prepare for the Certified Medical Surgical Registered Nurse exam.
The AMSN certification review course covers various topics that are found on the exam, as well as test-taking tips and strategies.
Offered in a live or online format, the course provides nurses with an increase in knowledge to better patient care, various professional development opportunities, and preparation for the CMSRN exam.
Learn more and register for a course by visiting amsn.org/education.
On this episode of Med-Surg Moments,
attended my 20-year reunion.
They have me doing audits, so I'd become like the enemy of every nurse on my floor. And
I had the chance to meet some really cool and advanced middle schoolers, very interested in becoming nurses.
Lent started, and so what I chose to give up was buying
how to optimize your nurse educators.
A common myth is that your nurse educators are there to do your work. That's not.
You said rules. I do run and hide sometimes.
I like this episode because it's an opportunity for highlighting how we can.
I know that you are the kind of educator that I wouldn't have run from, because
what's some advice you have for people that are considering joining that side of the nursing field? Or what do you wish you knew before you became a nurse educator?
Education is empowerment at the bedside.
So I got questions because we're talking about myths and realities and all these things. Do you guys ever get pushback?
Sometimes I went home crying that first year, but I would return and have that conversation with my education coordinator, and she would...
I get that, oh boy, here comes Kellye, she's a patrol. I look at it like this.
This is Mary Tess,
Sam,
Eric,
Marcella,
Kellye,
and Sydney. Welcome to Med-Surg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud Med-Surg nurses just like you, sharing our stories, insights, and experiences to support you in your nursing journey.
Our topic today is how to optimize your nurse educators. But before we get started, how about some personal updates? Kellye, why don't you start?
Sure, Mary Tess. I know I told you all last time I joined the gym and things like that. So that's been going pretty well. I've also attended my 20-year reunion with my college university. We had a homecoming experience. So I was able to drive on to South Carolina just to see some college classmates I haven't seen in a very long time. So that was refreshing just to get out and see everyone after 20 years that I've graduated from college. So that has been amazing. Professional updates. I've been finding some more volunteer opportunities for myself. I had the chance to participate in a career fair to represent my nursing professional title. And I had the chance to meet some really cool and advanced middle schoolers. There were 8th graders very interested in becoming nurses. I had a couple of 8th grade guys, Eric. They were very inspired to want to become a nurse and learn more information about being a nurse. So I thought that was pretty cool. What about you, Eric?
First, let me say it's always inspiring to see young gentlemen speaking to the nurses about discovering the field. For me, I went to the doctor and got an update, and I've just got a couple more weeks of modified duty before I hit the floor running. So I'm kind of excited for that. In the meantime, they have me doing audits. So I'd become like the enemy of every nurse on my floor. And it's so terrible because my manager's like, I want you to audit this, and this. It was fine the first day or two because I would do the audits. And then she came back to me the next day. She said, I didn't see any communication between you and the nurse. I said, oh, you want me to call them out on it? She goes, oh yeah, we need to let them know. So now I let everyone know how bad their charting is. And I get nothing but stink eye now. As soon as I do an audit, I say, I'm so sorry. She's watching us. I have to CC the manager on the letters that I send my coworkers, so I feel super bad about it. But I'm like, it's the job. Please don't take it personal. But I know some of them are taking it very personal. And I feel bad because when I do it, we're only looking for the errors. So every time I send someone a correction, I always try to send them a positive. So I said, hey, you forgot this, but I see you did this really well. What can I do? I can't wait till I'm on the floor and I don't have to worry about any of that stuff. So it's just one day at a time. Sydney, how about you?
Oh, Eric, I'm so glad to hear that you're at least telling the nurses a positive because, yeah, that's the worst feeling when you're getting an email or a conversation from an auditor and you're just like, oh, well, what else is wrong? You know, I can't do anything right. It's always good to get a positive with a negative. For me, I just finished my first master's course, Health, Politics, and Ethics. I learned a lot about the ANA Code of Ethics and a lot of different avenues that nurses can have to be advocates and leaders in other ways than just at the bedside, whether that's within their hospital system or on a larger scale. So I have a break this week before my next class starts, advanced anatomy and physical assessment. So that'll be, I think, a different side of classes doing more memorization versus ethics and paper writing and stuff like that. So I'm excited to start that course next week, but I'm really looking forward to the break this week. Mary Tess, what about you? What's new with you?
I love to hear that you're looking forward for the breaks because that's how you can recharge, right? It's like I always look at the calendar like, oh, there's a break. Maybe I could go somewhere, something like that. Thanks for sharing that because I'm so proud of you moving forward, getting there. You'll get it. You'll get it. Eric, I think I know what the advanced degree that you can do. Leadership and management. I think you're doing great. Doing the audits and giving positive and coaching and recognition.
I love assisting the nurses to better themselves. I don't like bossing people around. I lied. I like bossing people around, but I don't want to work that shift.
Updates. I'm going to the Philippines soon for just a quick 10-day trip. It's my cousin's wedding anniversary. It's actually her 25th wedding anniversary. I was her bridesmaid, maid of honor, actually. I was her maid of honor when she was married. So she surprised me and said, can you be my sponsor? I'm like, am I old enough to be your sponsor? It's something that she wanted to really redo the original wedding. This time, the bridesmaid being the sponsor. So I'll be traveling with my husband for just a couple of days and then come back. So I'm really looking forward because I don't know how that would go because I don't know if I'm going to enjoy it or not because the travel is very quick. Professional update. I love what you shared, Kellye, about speaking to students because that's what I've been doing recently. Nursing students who are trying to find their professional identity. So something that I've been working on, I've been doing a couple of talks and discussions with nursing students, what they wanted to do. And I always wanted to focus on what specialty they wanted to be in. And so, of course, as you know, I always wanted to tell them Med-Surg is a specialty. So, Marcella, what's going on with you?
Kellye, you did not text me to go to church those Sundays. You're supposed to be harassing me.
I apologize.
So I'll just blame it on you. When I get to the gates of heaven, I'll just let them know Kellye didn't text me. No, I'm kidding. As we record this, Lent has started. And so I've been discussing with my teenage daughter. We were figuring out what we wanted to give up for Lent. And I told her it could also be a goal, not necessarily like what you have to give up. But what I chose to give up was buying a single serving of coffee because my daughter and I have gotten on a roll of every day we just go through that drive-through. It has gotten to a bad level. So I stocked up on home coffees. Anytime I leave the house, I put one in my reusable mug. And that way I'm not tempted as we're passing. And what she decided to give up was talking bad about people. And I thought that was such a great idea because I can relate to, even on the nursing unit, I think we all know about this. It just happens. You start talking about the new nurse, you start talking about the float nurse, and you sometimes get wrapped up in a more negative perspective. And I love another chance to reset. Look at things from another perspective, try to say the positive. Kind of like Eric, I love that you're adding the positive thing about their charting. Charting is my kryptonite. I love nursing. I don't like charting, but if you didn't chart it, you didn't do it. So I appreciate that you tell them something nice about it.
Thank you.
And professional update, we were talking in our promo about those live certification reviews. I actually did one in Chicago back in November, and it was a 2-day event. And I am so glad that my Chicago chapter president, Cora Palmer, shout out, pushed me to do it because I did not want to. I thought, how am I going to find 2 entire days? I think each day was about 8 hours, if I'm remembering correctly. And it's almost like you wish it was more. First of all, it was in beautiful offices downtown. I live in Chicago. Most of these people were from all over the country. I live in Chicago, and I appreciated these offices in these high rises. I felt like I was going out of town to a fancy business meeting. I really loved it, and the food was great. So I am talking it up, but as someone who has not studied in 7 years extensively, and this live certification review really got me back into it in a way that was not scary, not intimidating, but it did remind me that I have a lot to review. So I have not scheduled my test yet because I want to do some more studying on my own, but that review session was a great kickstart to me going back and trying to get certified.
Those review sessions are great. That's what I did. I didn't do the in-person, I did online, but it really was. I mean, it was super helpful, and it really took away a lot of that stress and anxiety that I had. So I highly recommend it to everyone.
Why don't we move on to our topic, how to optimize your nurse educators? Nurse educators are cornerstones of clinical excellence and staff development, yet their roles can often be underutilized or misunderstood. So we thought we'd devote this episode to discussing the myths, the realities, and opportunities regarding nurse educators. I would like to get us started.
I'm a nurse educator. At our hospital system, we're actually called unit nurse educators. The unit nurse educators in our system, we are not masters prepared, but we are unit educators by way of our managers selecting us. So I would like listeners to understand we are there to help and assist. A common myth is that your nurse educators are there to do your work. That's not true. A lot of times I'm called by staff members, hey, this patient lost their IV. Can you just go put one in for me? No, we're not going to do that. Let's go together. We are here for coaching. We're here to reinforce the nurse competencies, to reinforce the rules, and to educate you all on new technology.
You said rules. That's my least favorite word. Eric, I know you're with me on this one. We talked about it a little bit. In our hospital, they're called education coordinators. And when I see them, I don't want them to do my work for me because I'm not brand new, but I do run away because I know they're going to ask me about my deadlines on my online learning modules and my competencies. And I love them so much for keeping track of that for me, but I do run and hide sometimes.
You make me sad. As I build trust with them, they realize she's not really looking at my online learning. Yes, it is, but also I'm here to help, to assist. Right now, I'm in a different role, but then when I round, they still would kind of like, am I in trouble? That's the first question they would tell me. Am I in trouble? But I would always say, I'm here to help. How can I help? My role is a clinical educator, but I also oversee the clinical educators. When I round in the units, it's more validating if our programs are being implemented correctly or how we can improve the services that we're providing to the staff. So when I ask questions, how do you think this is helping you? Is there any way we can improve the process? It's more of like we're asking for a process improvement. I like this episode because it's an opportunity for highlighting how we can optimize. How can we make the educator role be your friend, be your ally, and have that one-on-one conversation with the educator and ask for your professional development? Because that's the expertise of a clinical educator, your competencies. Maybe you want to go to a different skill set that you have not experienced. I remember there was one nurse, we were talking about IVs and then mentioned, you know what, I'm really very skilled already with putting peripheral IVs. Is there a way that I can learn how to do ultrasound guided IV? And that just came out. Oh, let me look for a program for you. And that's kind of where the education team can help advance your skill sets.
I know I said I'm anti-rule, but I really think it's important that we talked about that perspective of running away from the patrol, because like you said, it highlights that we need educators that don't feel like that. I know that Mary Tess, Kellye, and our team here, every one of you who are educators, God bless you. I know that you are the kind of educator that I wouldn't have run from, because it would be more a conversational situation where you push me to learn this next skill set, and then you become the go-to. So for someone who's excited to kind of get out of the mundane, new responsibilities push you too to get excited about the shift you're starting. And you guys really push us to learn that, and I love that.
Maybe I have a different understanding of what a clinical educator is, because I never had someone come around trying to teach me or help me with IVs or say this and that. Our clinical educators are the ones that say, hi, I'm here to show you how the new AccuVial works for the prescription. Here's how it works. Sign the binder. See you later.
That's why you have to take over where you work, Eric, because you're already doing such a good job to be that different kind of educator.
I've never seen anyone like you guys to be like, hey, how can I help you? The only time I've ever seen them is when they come around when something has to be checked off.
I look at magnet hospitals. This is a big part of new nurses looking for hospitals. Look for magnet, because your educators are held to a higher standard, to where they are including you in the learning process and telling you your resources that your hospital even provides. They'll tell you, you get a stipend for school. Let me help you find these classes and seminars. So that's why, Eric, you got to be that person in your hospital. Whether it's magnet or not, you can be that person that finds the resources.
You can be your own professional development person if your clinical educator is not that. But also you can be the clinical educator of the team. The clinical educator role of your healthcare system is designed differently. It's just that in my healthcare system, we have so many levels of clinical education. We do not have a unit base, but we also have a clinical professional development educator. We also have a clinical educator at the bedside. So much different levels. So if you didn't have that type of role in your hospital, maybe you can start to be that person and be the resource clinical educator, go around, help people around, because you're very knowledgeable. And I bet they would want you to help around as well. Now that you're auditing stuff, you can see.
Yeah, no one wants to see me.
Right?
No one wants to see me now. We're still struggling to get lunches and breaks. So before you have me pick up the nurse educator to round on people, let's get our 15s first, okay?
And then too, Eric, like Mary Tess, how you said different hospital systems call them different things. And with my hospital system, our unit-based educators are not called clinical educators. We're unit-based educators. And like I said, for the nurse that takes on that role, they don't have a master's degree in education. They're a regular staff nurse working full-time or part-time, and it's kind of like a super user or a qualified assessor. We are still required to work at the bedside 2 12-hour shifts. Now, we do bedside 2 12-hour shifts, and then we have 1 12-hour shift to do education work. So our office days or educator days consist of all the unit-based things. We do all the competencies. We help coach, we mentor. The biggest role that we do, we support our new grad nurses because we have a nurse residency. And so that's where I heavily come into place. I do the onboarding for the nurse residents. I pair them with preceptors. I train preceptors. I teach their classes. So it's just depending on the entity and the scope of what your nurse educators are defined to do or what they're called.
That's true, Kellye, because now that I think of it, I know we have a nurse residency program, and I do see educators with them quite a bit. So I guess you're right. I guess it's where they put it.
Correct.
So Sydney, I know you've had some unconventional roles. What do educators look like in your field?
From what I've seen, our nurse educators work in a variety of different positions. They can either continue to be bedside, kind of like Kellye said, and then also doing education mixed in with that. Or a lot of them will work in our staff education department, doing competencies and online trainings, ALS, BLS, tracking and monitoring. So it doesn't seem like it's too different from the variety of roles that nurse educators can do on the civilian side. But I was going to ask our two educators here, as someone like me that's just starting a nurse education degree, what's some advice you have for people that are considering joining that side of the nursing field? Or what do you wish you knew before you became a nurse educator?
I love this question because it's like telling the journey of how did you become a clinical educator? It was so very accidental. I remember right off graduation, the dean of the college where I graduated asked me to be an educator. And I said, no, I can't. I just graduated, just so you know. I need to still learn and do what I have to do at the bedside. And so I declined and I said, no, I can't. I have to go back and go to the bedside care clinical first. But then after 2 years of being in the Med-Surg unit, I had to split my roles, clinical and academe and clinical instruction. I did that all at the same time. My reason, if I'm at the bedside, I'm taking care of 6, 7 patients, right? But then if I am educating a nurse, that nurse that I have educated will impact 7 patients. And if that nurse will teach another nurse, because I did a great job with teaching another nurse, that would impact the whole unit. And that really motivated me to kind of like, this is where my passion is. I would still be directly clinically involved, but then also to upgrade my skills, to improve my skills. The only way to do that is to teach other people because you cannot teach what you don't know. So that was my transition. And from then on, that's where I started loving to learn and doing education because I've been in a unit-based, I've been a content creator, like an SME, and then now I'm in leadership.
I think that's a great perspective. Like if you give a man a fish, he'll eat for a day. If you teach a man to fish, he'll eat for life or whatever that expression is. Because the more you pass along, the more people that are going to be affected by that good skill and that good knowledge. So
the biggest fulfillment for me is when I see them be better than me. Like I've seen the new nurses that I've helped before during onboarding. One of them was a CNO and I'm like, she was in my orientation. She was just, it's a huge fulfillment because you know that you've been part of that journey and that you know that somehow you've motivated them to move forward. And you can tell I'm getting so happy and passionate telling that story because it's true. It's a huge fulfillment to see all of you guys succeed.
Yep, Marites, I can definitely relate to her story as well. And for me, my manager called me out my second year of nursing. And she said, you just do a wonderful job, Kellye, at precepting. In my first year, I was precepting an older nurse back into the role of nursing. She was out of bedside for 15 years. And so when I precepted her, I was able to speak to her on her level. I met her where she was. And so I always tell my newer nurses, whether you're transitioning back into the role, whether you come straight out of high school, straight out of college, education is empowerment at the bedside. Being an educator, I take pride in being an educator. I take pride in supporting new nurses, giving them the wisdom that I have, giving it back to them, seeing them grow in the profession because it's growth, it's learning. And I call all my new nurses baby nurses, to seeing my baby nurses as the CNOs and the nurse practitioners and the travel nurses, knowing that I impacted them in their decisions. And you can tell when you have that passion is when your nurses are working right beside you and you knew that you trained them. So you know they're going to do the right thing because you trained them. You instilled that in them. So that's how I look at it. That's what motivates me, is creating a team of nurses that you trained.
So I got questions because we're talking about myths and realities and all these things. So what kind of education are you guys talking about? Like requirement, hospital specific requirement?
Yeah. Reinforcing the policies of your hospital. Like we use Lippincott at my system. So I just reinforce the policies and procedures. I also educate by initial competencies as well. I educate at the bedside, being a preceptor, ongoing continuing education, supporting them, having them join committees, having them be a part of leadership teams, and anything education related is what I look at and what I do.
Do you guys ever get pushback? Because the way I look at it and what I've heard from, being floor nurses, they're like, oh, the clinical educators are just part of management. They're not here because they really care. They're here because you need to do A, B, and C. Fine, I'll do it. I'll just listen, or I'll just hit those health streams, just hit next.
Eric, I totally agree with you. But
Right?
I will say as a baby nurse, my EC or education coordinator It was so reassuring to know that there was a specific role of someone that I can run to in literally every situation. And sometimes I went home crying that first year, but I would return and have that conversation with my education coordinator, and she would review what you did well, and this is what you didn't do well. And that's why I also love positions that offer for new nurses, that nurse residency that you talked about, Kellye. And Mary Tess, the way that can integrate it into more of a mentor role. I definitely experienced that in my first year of nursing, and I have to give credit to that. I know I joked about running away from patrol, but as a new nurse, that was so crucial at the end of a day where you're scared of killing someone. It was so nice to be able to run to someone and unload, but also learn at the same time.
I get a lot of pushback, Eric, all the time. I get that, oh boy, here comes Kellye. She's a patrol. I look at it like this. I'm giving you the tools and the resources you need to protect your license. I'm trying to help us as a unit improve patient safety. So here as the educator, I'm giving you the tools. Now, if it's something I don't know, I will let you know. I may not be the best at this skill, but I can pull up this Lippincott policy. So I kind of flip it back to hold the accountability on my nurse and my staff, but then I'm just here as a resource, utilizing me as a resource.
As an educator, we can also be part of an organization, and it's the Association of Professional Nursing Development, ANPD, and it does have several roles. And one of my favorite roles that I really love to do is we are mentors, we are champions for inquiry. What that really means is that if you're in the clinical area and you see a gap, if you see something that's not working well, connect with your educator because that is their expertise. What they're going to do is to identify that gap, do an environmental scan, and look for evidence-based practices because probably your policies are no longer updated or valid. And so your clinical educator will work with your leadership team. And just like what you guys said, do you get pushbacks? Absolutely, because they will be like, oh, you know what? That is no longer updated. And a new nurse would say, this is what I've learned in nursing school. And, I always listen to them. And I would say, because they were just in school, they have the best practices. So we really need your help. If you're working directly with a patient and you've seen something in your policy is not working right, connect with your clinical educator right away because that is where problem solving is. That's where we design the education. And the best part is we design it in a way that you like. If you don't like online learning, tell your educator because guess what? We are creative too. So we're going to design an education that you like. Well, believe it or not, we're just about out of time. But before we close, let's go around and have each of you share one thing you will take away from this episode.
One thing that I will take away from this episode is actually a gap. When I was remembering my first year as a nurse and how I said I felt like I'd run to my education coordinator, that's what we need so that more seasoned nurses don't just think of the educators as the police. We think of them as someone we can go to, as a new nurse, it's a personal level to just divulge anything and everything. And then when you become more seasoned, you're like, don't tell me what to do, But if we make it more of a relationship, touch base annually, what's going on in your career? What's going on? What are you thinking about? How are your hours going? I think some way for us to make education coordinators an integral part of the seasoned nurse also, not just the baby nurse, that would be really good.
What I'm going to take away from this is that I need to give our clinical educators another go round, and I need to reevaluate the way I think of clinical educators in our facility. They seem like they can be a very valuable tool that can assist us. And not just run away from them like the police.
Yeah, I really like what Mary Tess said about when you identify those gaps, going right to your educator and then working with them to improve that policy or working with them to build that education of what's going to be the most effective. Because I think, doing the death by PowerPoint online trainings can just be so overwhelming with everything else you feel like you have to do in the day. But I love a skills fair. Cute poster board and a little hands-on. Those are always really fun days to go and refresh on some skills or learn something new, learn a little trick that someone has up their sleeve, learn, oh, well, actually, the most up-to-date research says this now. And you wouldn't know that if you didn't have your educators in that back pocket, keeping up to date on all those things for you.
Takeaway for me being a nurse educator is maybe doing a little spring cleaning on my unit, updating my roles to my new nurses and my senior nurses, letting them know what I do, being a little more creative at introducing the new technology, the new policies, new procedures, and just being a little more creative in my role.
Improv, some role playing.
Yes, exactly. Role playing and some more simulations. Thank you guys. I will do that.
To our listeners, thanks for joining. We'll see you next time. We look forward to connecting with you on the next episode of Med-Surg Moments, the AMSN podcast.
In the meantime, we encourage you to subscribe to Med-Surg Moments wherever you listen to podcasts.
To reach us, use hashtag MedSurgMoments on your social posts.
Or send us an email at amsnpod@amsn.org. That's amsnpod@amsn.org.
We are all AMSN members, and if you love Med-Surg Moments, we invite you to become a member of AMSN. You can learn more at www.amsn.org.
Finally, the content within the Med-Surg Moments podcast represent the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses.
Until next time, this is Eric,
Mary Tess,
Sam,
Kellye,
Marcella.
And Sydney. And always remember, Med-Surg Moments is a moment in our lives and a moment in our Med-Surg careers that makes a huge difference.